think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
Dr. Bash, how you and Bill doing today?
I'm doing good. Bill just called in and wanted to know what the link was. So Bill just called in and wanted to know what the link was, so I sent him the link for the radio, so he'll be here in a second.
Yeah,
but,
am I in?
Am I there? There you go, Bill. Yep, Bill's in.
Hey, all right, I made it. Hey.
What a day. Well, good
so Bill,
deal.
I'm just about ready to tell him about my new little YouTube video. You can YouTube Craig Bash, and it's got a little 6-minute video on veteran stuff. It's got a bunch of contact information at the end, you know. So that's newest and brightest, yeah. And then Bill and I, we had a couple of cases recently that we thought we might talk about, and I think that that Pastor wanted to talk about the meals ready to eat or the rateable case you talked about last week a little bit, Bill.
Sure. I'm up for whatever we need.
Yeah, so what was that called? Last week you described the thing you used for yours. It was called rateable case or something? Ready to read?
A decision ready claim.
Yeah.
Ready for
that and the process basically before the case goes to the rating board for a decision, the development team, the pre-decision team, is to assemble all the relevant and necessary evidence and make sure that the case is, quote, ready for a decision. And then they transfer it to the rating team for a decision.
Oh,
so
you just can't. Go ahead, Dr. Bash.
Well, I was going to say, if you get it kind of like baseball, you get it ready for the batter to hit it, right? So the pitcher puts it in the box, and so the pre-decision team gets it all set up. Is there a certain pathway for that, Bill? Something you have to apply for something special, or you send it in with all the details?
It's just a general process that's described in the manual, and your offices are generally divided in 3 parts: a pre-decision team that assembles evidence, a rating team that makes the decisions, and then what they call a post team, meaning post-decision or after the decision, a post team that is tasked with implementing the decision and making the payments. And each section has their own responsibilities in that regard.
So in your case, when you put it in, you said this is a rateable case, and kind of told the pre-decision team that they could move it forward fast, something like that?
Oh, yes. Well, in recent history, VA has now created a standard called the decision ready claim. And you must use a representative for that to help you prepare your case. And if you have assembled and presented VA with all of the evidence they need to make the decision, VA attempts to try to have that decision done within 30 days. And in fact, in recent history, VA actually did that for me.
So it's good. That's good.
That is good. Look at all the time you can save. And Bill, you know, if they do happen to deny you, you still have the right of appeal, right?
Absolutely. That didn't change.
Mm-hmm.
Well, I think
what about seeing pigs then?
Come again?
What about seeing pigs then?
VA has published these disability questionnaires, DBQs, and those can be completed by a physician of your choice, and you can submit it with the claim.
Or a DBQ?
Yeah.
Yep.
Now, what happens if supposedly you're with an outside doctor?
Any doctor.
and well, yeah, and they want to write put an opine on there. There's actually no location for that on the regular DBQs. Now,
That's correct.
So they just attach the opinion?
Certainly.
What I do.
Certainly.
Yeah, that's what I do.
Submit it on your letterhead, the physician's letterhead, that is, and sign it, and that's good evidence. It's important when one does that. It's important for the opinion to offer the reason. Okay, it's understandable if a doctor says, in my opinion, this gentleman's ankle condition today is related to the ankle sprain he had in the military 50 years ago. Okay, but why? How do you know that? And what evidence are you relying on to support that conclusion? And if that explanation is reasonable, I have every reason to expect the claim would be granted.
So, Bill, when we do ours now, I'll write my nexus letter about the topic, and I try and link my nexus letter so it's consistent with the lay letter, and the lay letter and nexus should be consistent with the medical record, and the medical record should be consistent with the testing, and then should be within whatever rules. So sometimes
in a perfect world, yeah.
Yeah.
In a perfect world. But we live in a messy world, and sometimes there are clues. Sometimes, many times, military records aren't going to contain perhaps a precise diagnosis and a precise symptom. How often do military members endure pain, endure symptoms, and don't report them? That's part of the culture. So it might not even be documented. However, a veteran's statement that they experienced symptoms is evidence. If it's a sworn statement, it's evidence, and it must be considered. The courts reviewed that several times.
Okay.
Mm-hmm. Yeah.
I was going to use that concrete example of a case we had recently. You talked about a little bit the night vision goggles.
Oh, certainly. Take the case of a pilot training other pilots to use night vision goggles when they're flying. Now, these helmets and goggles and the counterweights in the back of it to make it balance exert forces on the neck as the helicopter maneuvers, or the pilot looks in different directions. So you take a person who, after service, made no complaints while in service of a neck problem. Didn't seek care for it anyway. And now, years after service, they have a very advanced degenerative state of the cervical spine. Now we've got blown discs, and we've got cord compression and nerve root compression, and all these terrible things causing plenty of manifestations. Now the question is that natural aging, or did it result from trauma, like the forces of these night vision goggles? Even though the veteran didn't report it on active duty, his statement that he experienced those symptoms in service while flying, okay, is evidence, and it counts. Now, the doctor can look at what the veteran tells them, and the doctor can compare that with his knowledge of the medicine to say, well, this is what I would expect if it was a result of trauma. I wouldn't expect it to be this bad if it were just aging at this veteran's age. And that would be a plausible basis for granting the claim.
So many times, Dr. Bash, when I do these cases, the VA will send them out for CMP exam, and their sort of go-to phrase is, this is the aging process. So what Bill's saying is you have to have another doctor opinion to counterbalance that, and also see if the lay letters corroborate the fact that he had a chronic process. Right, Bill?
That's right.
I remember. Yeah? What was that?
Now, how many people using pilots using night vision, or anyone using night vision, going to start complaining about their neck hurting because they'd be afraid they'd pull them off of out of duty?
Yeah, lose your flight play.
Yeah, that's exactly right.
Or prematurely end your career.
Through it.
That's exactly right. And is that not part of our military culture?
That is our military culture. The worst thing you could do in the military is go on sick call. I mean,
absolutely.
If you're a pilot, you're told to stay away from the flight surgeon.
You bet.
Absolutely.
So my dad was a World War II fighter pilot, right? And he got drafted in the war and went through the aviation cadets, So now he has a son that's a doctor. And he goes, doctors are only troublemakers. That was his words from the first pilots in World War II. So it's a very long process to stay away from physicians,
Your dad was in the Army Air Corps, wasn't he, Dr. Bash?
Yep, yes, sir. Brown shoes. So even back in the day, the doctors were trouble.
Yeah.
So Bill, I saw a lot of. I've seen other pilots that have, besides the night vision goggles, just the fighter pilots or any of those guys that have a helmet on, because if they're pulling 2, 3, 4 Gs, 4 times 10 pounds is 40 pounds. And I've seen some of the worst spines. Yep, I've seen some of the worst spines in my entire career from fighter pilots and G-force pulling guys, just from those helmets, bigger than football players, bigger than, and it's multiple discs. The necks are a mess. So it's a real deal.
Yeah, and think of those Navy pilots hitting that carrier deck.
Yeah. And they get neck and low back, all.
Yep, they do. Of course, now you got to hit it at full bore. You can't let off the gas. You got to hit it, wide open, because you have to be able to have enough inertia to go around in case something, that hook doesn't catch. You better get out of dodge.
Mm-hmm. Yep. So I had a guy recently too that was a pilot that had all these things, like he had retinal tears in his eyes from too many G forces. The new planes pull so many Gs. He had hemorrhoids and rectal prolapse out his rectum, bleeding because of all the G forces. Of course, he had neck disease and shoulder disease and back disease. And,
Could you imagine flying a $500 million fighter jet, and the only thing keeping your butt on the carrier when you make a land is a $250 tail hook?
You've got to admire those guys. Got to admire them.
Yeah, I got to. I'll tell you, Dr. Bash, what I've seen too in my lifetime a lot is in the radiology field. You have a lot of radiologists, and you have a lot of heart cath docs that develop a lot of back problems because of wearing that lead all the time.
Yeah, that's right. So you don't realize there's a lot of weight. In fact, I had some back problems, and one of my the weight was bad. And one of my professors had a shield that was made out of tin. This tin will also shield the X-rays, and it's a lot lighter, but it's really very expensive. So at one point, I almost got myself a tin shield. But there's a lot of risk there. Radiologists classically die from radiation-induced cancers, bloodstream cancers, and there's a high rate of cataract formation and, skin cancer. And, the first, Dr. Rankin, the first guy who did the radiology stuff, you see that classic picture of him with his ring on his finger, that classic X-ray picture. Well, nobody talks about it later on. He had vascular necrosis and lost some of that finger because of the X-rays that he got on on the first sample. So, this occupational hazards all over the place.
Yeah. Mm-hmm. Yeah, it's not fun to wear. I know that. But,
we were discussing last time, and we were discussing earlier about the importance of medical evidence when you're trying to establish entitlement to compensation. And the raters are all well versed on the fact that they are not supposed to use their own opinions when it comes to a question of medicine. They're to rely upon an expert medical witness, such as a VA examiner or a private physician. And I happened to come across this. I had a reason for looking it up, and I thought I'd share it with you tonight. Because many times we're going to find ourselves in having a veteran make a claim that he has developed a secondary condition. In other words, he's service-connected for condition A, and now condition B has been caused by the primary condition. So they call that secondary service connection. Now, it doesn't necessarily have to cause it. It can be granted, predicated on the fact that your service-connected disability aggravated it. Okay, so take, for example, you have a very severe mental disorder and you have a pre-existing hypertension. But if it can be said that mental disorder contributes to the hypertension, then it can be service-connected on a secondary basis. Now, here's the pitfall.
Okay.
The manual has been revised, and the instructions given to the rating board now informs them that the responsibility for submitting the evidence rests with the claimant, not VA.
Mm-hmm. Bill, can you say that again a couple times?
All right, here's a direct quote. For those that like to follow along, if you look in the VA's Adjudications Procedures Manual, M21, Part 4, Section II, and I'll read off the rest. 2B, 5B brings you to this precise section. That's M21-1, Part 4, II, 2B, 5D. And it says the responsibility for submitting evidence rests with the claimant. Okay? And it also, now there's a bunch of sections here, like 5 paragraphs and 4 notes. Okay? And contained in there, it says VA will satisfy the duty to inform the patient, the veteran, of what they need with the standard Form EZ application. That's the automated, pre-printed Section 5103 notice. They say that satisfies the, quote, the duty to assist the claimant. Okay? Now, it says here too, do not request further development if the veteran or the claimant failed to provide evidence establishing the baseline and the degree of evidence. The degree of aggravation. So think about that for a minute. What the manual is actually instructing is that VA is not responsible for determining the baseline and the degree of aggravation. the claimant has to put in the medical evidence to establish that. And, why it's going like that, I'm not so sure. I always thought we were supposed to assist the veteran,
Well, claimant would have to go out to an independent doctor then, such as Dr. Bash, wouldn't he? He couldn't rely on a nurse practitioner.
Yeah.
Dr. Basher. Yeah, so this is a very important point because in the effort to try and streamline claims a little bit, they're putting the onus of the exams on the patient. And then, I'm only one doctor and I only have one serious set of skill sets, so I can't opine with very, great degree of evidence and like maybe a foot disease or maybe cardiac disease. So what I'm trying to do now is I'm trying to suggest to the patient and to the VA rater that, these other exams are needed. They'll help me with that too. We're working them up like we might go out and get a podiatry exam to support my exam. We might go out and get a cardiac exam to go with my exam. We might go out and we're sort of starting to have to get subspecialty exams to booster my exams because in the past I used to make my opinions based on those subsectors, but I wouldn't necessarily have as much depth of knowledge as what they're requiring now because I knew that when I made my opinion, it would force the VA to go out and get their own exams, right? They have to go get their own DBQs, and a lot of those doctors would agree with me, and then the case is going in the right direction. But now with this new thing that Bill's talking about, the raters are kind of precluded from developing cases on the backside, and it's more of an onus on all of us who are trying to develop these cases on the front side to get more and more evidence. Right, Bill?
That's right. I mean, and here's I'm going to read this out loud for everyone under the notes in that section. Do not request an examination if the veteran has failed to furnish medical evidence establishing baseline level of the severity of the non-service connected disability. If no baseline can be established, no aggravation can be demonstrated, and the claim should be denied.
So, Bill, does that apply to other parts of the Schedule 2 bill, where they've been told not to get exams?
No, this is not a general rule for all parts. This is just something that the VA has put in the section regarding secondary service connection by aggravation. And
by what right do they have to put that in, Bill? They keep changing the rules as we're driving down the road here.
Well, I must confess, I've had that argument with my colleagues before I retired many times.
Well, I mean, they had to get that authority from somewhere.
I have to share with you, and I'm sure you'll appreciate the humor of this. VA's compensation service used to come out with what they call service bulletins, okay? And they would sometimes come out monthly or thereabouts. And they would pick a topic and they would explain VA's position on how to develop and how to decide a particular issue or something like that. So in September of one year, a bulletin came out and they were attempting to clarify how to evaluate disabilities that are on appeal and select an effective date. And they gave an example. The example was that of a veteran with a service-connected shoulder. Service connection is granted. The VA examination under the rules at that time. We're satisfied that the examination warranted 10% disability. That's no longer the case because the minimum rating is now 20. But at the time, 10% was an acceptable decision based on the evidence. Now the veteran appeals, and the veteran gets a new exam that warrants a 20% evaluation. The example compensation service gave in the bulletin was assign an initial valuation of 10% based on the first exam, and as of the date of the second exam, a 20% evaluation. Well, that's just one of those I couldn't live with. So I composed a memorandum and sent it up through the chain of command and tried to help the folks understand that that instruction is directly contrary to VA's General Counsel Precedent Opinion 12-98. And the Precedent Opinion of the General Counsel is binding on our decisions. And I guess it was maybe 5 months later, they rescinded the bulletin and said, apply the General Counsel Precedent Opinion. If someone's interested in that sort of thing, if you get an evaluation and you're not persuaded that that's a correct evaluation, you certainly can appeal that. And then VA develops the evidence, or you submit the evidence, and VA determines you're entitled to, yes, a higher evaluation. Well, that new evidence that justifies the higher evaluation applies to the origin of the claim.
Thank you all for listening. That ends this show. And now I'm going to zoom off.